everyone, and happy Monday on a holiday week. We are here today to discuss a very important topic, especially this week. Welcome to Dr. Christine Calmes and Dr. Paula Smith-Benson.
Hi, everyone.
We are here today to discuss trauma and triggers and how veterans can get through the 4th of July celebrations. If anybody lives downtown, you will know that it was very intense this past weekend with multiple jets flying around, with lots of people, lots of military in the Inner Harbor from various countries, not just the U.S. I know I was surprised to see the UK jets flying in formation around downtown. And because it is the 250th anniversary of our country, we know the fireworks are going to definitely be intense this weekend. So we're going to talk about all of this and more. So thank you everyone out there who's joining us, and welcome to Dr. Calmes and Dr. Smith-Benson. Thank you for joining our live today. So I guess one of the first things we really need to talk about is what is recovery? First, what is a trigger and what is a recovery? So I guess we could use those two items to start the conversation.
So good afternoon, everyone. Dr. Calmes, would you like to start with defining a trigger, and then I can respond after you?
Sure. A trigger is a situation that brings up often really intense physical, emotional symptoms that are linked to a situation from the past. And again, they tend to be very intense. They tend to be sensory, something you're hearing, seeing, smelling, tasting, or feeling on your skin, that brings you back to a significant experience that you've had in the past, or a traumatic experience. So before we dive into this, I really want to remind you all who I am and what my role is, as well as Dr. Smith-Benson. So I'm Christine Calmes. I am the Military Sexual Trauma Coordinator for VA Maryland. And do you want to introduce yourself?
Sure. Thank you. So good afternoon, everyone. I'm Dr. Paula Smith-Benson, and I am a certified peer specialist, and I'm assigned here at the VA Maryland Healthcare System. And I am also an individual that has a diagnosis of PTSD, as well as the experience of military sexual trauma.
Great. And so today, the things that we're talking about definitely apply to people who've experienced military sexual trauma. And they also may apply to veterans who've experienced other type of trauma, like combat trauma. So a specific example of a trigger for a veteran who's experienced military sexual trauma might be seeing someone who looks like the perpetrator or the person who assaulted them.
Absolutely. Yeah, and I'll thank you very much for that. I'll also say that in my personal experience, it's been smells. So it could be a fragrance that reminded you of the person that may have chosen violence or aggression at that particular time. So maybe even a cologne or a perfume or something like that. What I also wanted to add is that oftentimes for me, I was not able throughout this recovery experience to even identify the trigger. So there are some times when I'm not exactly sure what might have been the activating experience. What I notice are the physical symptoms. So perhaps I'll start breathing a little more rapidly or more shallow. I may notice that I'm starting to perspire, or maybe I'll feel hot or flushed. Um, Oftentimes, it may show up in relationships with family and friends, and I'm a little distant, perhaps, or maybe a little detached, and I may not even be able to pinpoint it. So, what I'm so grateful for is our bodies are designed to provide information. So, really, having these experiences can be somewhat helpful if you are willing to be curious, maybe not even naming it a trigger, but just naming the feeling. I just noticed that I felt fearful, or somehow I'm feeling a little, concerned about it's a lot of people out here, or I'm just a little jumpy because it's a lot of noises. So I just
Mhm.
express that to folks that we don't always know, but our bodies will help us to not only prepare ourselves, but it gives us the information that maybe our coping skills that we're using, we might need to try something else. So
Mhm.
that's how I have chosen to rethink it.
Mhm.
So,
I
Christine, can you
really,
talk a little bit about the triggers that combat veterans might experience? Like, in because I know you also treat veterans who have
yeah,
PTSD. So, can you
yes.
talk a little about how people who were in the military and who've had combat experience, what may be possible triggers for them?
Sure. Well, there certainly can be overlap between triggers for veterans who've experienced combat and those who've experienced MST, but certainly loud noises, explosions, aircraft overhead. These are all things that can remind veterans who've been in combat of combat. And I think what can compound this is that these are not things that they encounter every day stateside. So during a time like the 4th of July, they may find that they're very much on edge. They've not gotten used to hearing loud, unexpected noises, loud aircraft overhead, that sort of thing. And then that coupled with a lot of people might have them feeling very much overwhelmed, and they may notice even that some of their other PTSD symptoms are elevated, like they're having nightmares about combat when they haven't had them in a while, that sort of thing.
Absolutely. And thank you for bringing that up. I wanted to add just a couple things too. So, in terms of what you were saying, Rosalia, even the smell of smoke
Mhm.
from the devices and such that are used, um, a lot of that resembles nighttime maneuvers and things of that sort, because, of course, the sun has gone down when the fireworks are usually discharged. Secondly, traffic. Traffic can be also a trigger for veterans that have experienced combat or not, but just as perhaps a reminder of being in a convoy and just
Mhm.
seeing cars that you're now trapped in this line of traffic and you're kind of surrounded. And that
Mhm.
can also be very uncomfortable for a combat veteran or a veteran that may have experienced military sexual assault, where they did not feel like you feel like you can't get away, or you can't
Right.
get to safety. So I just wanted to add those two additional things to consider.
Those are great examples. And I also want to highlight that there are many veterans who have experienced both types of traumas, both combat and military sexual trauma.
Mhm.
And they may notice sort of an interplay between some of the triggers. Um, especially if the military sexual trauma did occur in a combat zone.
Absolutely. Thank you.
Is that possible that an MST can happen in a combat zone? I mean, I'm a civilian, so my idea of combat zone is, probably based on movies. So how would MST occur in a combat zone?
It's actually fairly common, believe it or not. It could be a fellow service member. It could be an enemy. It could be a stranger. It may occur outside the wire, on the base, the fob that the person is on. I think that there are a lot of stressors in a combat zone, and that can cause people to engage in behaviors that they maybe normally wouldn't. Also, they do not have the support that they would have stateside potentially. And there can be a lot going on. So people aren't necessarily paying attention in the same way that they would be if someone were stateside. So there's a lot of reasons why MST occurs in a combat zone. And I would say it's not uncommon.
That's really remarkable to me because as a civilian, you think there's MST and then there's combat, and never the twain should meet.
Yes. However, they do meet. And I always like to throw this out here. MST is not an experience that is exclusive to female veterans.
Yes.
All veterans can experience military sexual trauma.
And they do.
And
we know, yes, a fair number of male veterans have experienced MST.
And oftentimes these experiences may or may not be reported, which is why it's so wonderful that we do have an MST coordinator, because people have direct access. Even if you're not enrolled in VA care, but you're listening to this and you're thinking, I'm thinking I may need to talk to somebody. Well, you can go directly to Dr. Calmes and report this experience or the need to get additional support. And that is just a great way to get started on the healing journey. And that's absolutely why we're here, because these experiences are called triggers because they happen so quickly. They happen very, very fast. So our intention and purpose for today's conversation is so that we can sort of create some space between the activating experience and how we're reacting, and perhaps talk about how we might respond. So there are some things that we can do to prepare ourselves and to I would say just strengthen our coping mechanisms and supports, and knowing where to go if there is something that you may need. So if there are combat veterans out there, the Department of Veterans Affairs has the vet centers, which are available to combat veterans. They're also available for survivors of military sexual assault. And of course, we're here at the VA Maryland healthcare system as well. But there are options. If anyone is out there and you feel like these symptoms are coming up and they may feel distressing and overwhelming, we as veterans have the option to go to urgent care. We can also go to the emergency department and share these experiences and get seen. And then we have 988, the Veterans Crisis Line, and press option 1. So to my comrades out there, just like we would prepare for deployment, or we would prepare to transition from peacetime to a different ops tempo in a deployed environment, that's kind of why we're on today. This is sort of our pre-4th of July check-in, so we can check what's in our duffel bag of support, and we can make sure that we're prepared for anything that may come up that may be unforeseen. It may happen in the moment, and I want to put this out here, it may not happen at all. But it's best that we're prepared. So I'm excited about today, so we can talk about some of those things that can be instituted ahead of time, anytime, but particularly if things are happening this weekend. So thank you for allowing me to just kind of put that out there.
So
yeah, what
a little bit. So we're talking about triggers that happen very fast. So talk about those triggers and what veterans can do when they, Paula, you said your body tells you. So when your body is telling you, what are some things that veterans can do in addition to calling 988? Like, when do they know they need to actually dig out their tools from their duffel bag of tools? When do they need to go to the ED? Can you walk us through that?
So first I want to say that these are all, my comments are based on my own personal experience, and every veteran's experience is unique to that individual. So I can't make any generalizations, but what I can say is that it took me quite a while to gain this level of insight, and I'm still discovering and learning about myself along the way. I have not arrived anywhere. Just letting folks know I haven't arrived. I haven't crossed any finish line or anything. I'm still a work in progress. So I think the first thing is to have these kinds of conversations, which helps to reduce what we call stigma, which are the negative thoughts and feelings around the conversation. And then one of the key things is support. Many of us don't have a large support system, maybe families and friends. Oftentimes, we may have lost touch, may have moved a lot, just various factors. So number one is the support system, whether it is like a VFW or whether it is a veteran organization that could be helpful. There's also going to be the VA has a wonderful a host of apps that can be used at all times. Most of us have our phone with us at some point. It's not too far. So if you go to your app store, whether it's the Google app, the Google store, or to the Apple apps store, you can just put in Department of Veterans Affairs and a whole list of apps will come up. So there's PTSD specific apps, which will provide meditations, mindfulness, guided imagery, breathing techniques, as well as information sheets. So to your point, Rosalia, how do I know? Well, these apps sort of help you walk through it. So you don't have to walk through it alone or figure out like what's going on. There's also apps for insomnia that are out there. And they help you to maybe keep a sleep diary to see how long you're sleeping or the quality of your sleep, how you're feeling when you get up in the morning. There's also apps if you have just say anger, things like that. So I'm so grateful. And then there's the Beyond MST app. So for those of us that have survived MST, we have an app specific to support our needs. So I just say that the main thing is to know yourself. Get to know yourself without any judgment. Just information. I keep stressing this. It's just information, everybody. It's valuable information. So as you're noticing something, maybe use the notes on your phone or keep a little log or a diary, even if it doesn't all connect. But please, 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 these apps are completely free of charge. There's no in-app purchasing. It's all available to us. So I encourage everyone that is comfortable using their phone or electronic device to tap into those apps.
Definitely. And you mentioned a lot of really helpful coping strategies for when people are noticing that fight or flight response in their physical body, where again, triggers often bring up intense physical symptoms that are your body's way of preparing itself to deal with a life-threatening situation. That is, your breathing increases, your heart rate increases, muscle tension, perspiration. A lot of people feel nauseous or dizzy because blood is leaving the head and the stomach and going out to the big muscle groups to either prepare you to either fight off the threat or flee from it. So breathing strategies can be super helpful as a way of directly countering our body's tendency to try to take in too much oxygen. So by slowing the exhale, we are countering that body's automatic response, leading to a natural relaxation, state of relaxation. Also, there are a lot of other relaxation strategies like progressive muscle relaxation. Again, this involves tensing and releasing different muscle groups, is going to help counter our body's natural response to tense all those muscles up. There are grounding strategies that will help connect you with the present moment. A lot of times when we encounter a trigger, it can feel as if we're actually back there in the traumatic situation. By grounding, noticing 5 things we see, 4 things we hear, 3 things we feel on our body or on our skin, 2 things we smell, 1 thing we taste, that reconnects us to our current environment and reminds us that we're safe, that we are not in the traumatic situation again. What are some of your other go-to strategies, Paula?
Yeah, thank you so much for bringing that up. So one of my go-to strategies is for grounding is I always keep a mint in my purse,
Yes.
either little Tic Tacs or just a mint. And that whole process of getting the mint, even if it's a Tic Tac, you can hear the Tic Tacs in the container. You can see the Tic Tacs. Then you can open it and you can smell the Tic Tacs. You can put them in your mouth and you can feel the Tic Tacs and you can taste them. Even with the individualized, like Lifesaver style candies, you can feel it, you can hear when you're opening the package. So I tend to keep a piece of candy, a Lifesaver with me most times. Sometimes I'll even have those little mini boxes of raisins, just those little, the ones that are very, very small. And I'll work with a raisin or 2. And again, I can see it. I can smell the raisins when I open the box. I'm putting the raisin in my mouth. I can explore and examine the texture of it and then the taste of it. So I have had experiences that felt like panic. That's a very different experience than what we're describing. And in those moments, I can't remember anything that I've been told. So the one thing that you brought up that helps me is I do know that if I exhale longer than the inhale, I don't even have to count, because sometimes in those situations, I'm not really I can't keep up with the counting. It's just too much. But I can say, okay, I can exhale. longer than I inhale. And that does reset. And then I affirm to my own self that I am present and I am safe right now. And I just keep reaffirming until those kinds of feelings reside. Another one of my go-tos is this did not come to stay. It came to pass. It passed before and it'll pass again. So I can kind of rest in knowing, okay, you can get through this. You got this. It's super uncomfortable, but you did it before and you can do it again. So even that positive self-talk is a huge go-to for me.
That's great. And what can veterans do ahead of time to maybe prepare to get through the holiday as comfortably as possible?
So I wrote a few things down, so I'm just going to read them so I don't miss anything. So here are some things in terms of planning ahead. Check out the local fireworks schedule. Know when the fireworks are going to be planned so that you can maybe make necessary preparations and adjustments. Communicate your needs with family and friends. Let them know how they can support you if need be. Create an exit plan. So if you happen to be downtown Baltimore area in the Inner Harbor and you're going to see the fireworks, kind of survey the area just to kind of get a feel for if I needed to leave quickly, what route might I take? And then schedule downtime before and after the event. So just sort of fueling before the event and then refueling after the event. So those are some things. Here are some other potential strategies: noise canceling headphones or ear protection, a white noise machine, or even listening to some calming music. Watching the fireworks from a distance or maybe even indoors is an option. Take breaks when needed and choose not to attend events if that supports your recovery. So it's okay to say, I'm not able to go this year, but perhaps I can join you next year. It's absolutely okay to do that.
I like that. And I like it because in PTSD treatment with the evidence-based therapies, we talk a lot about not avoiding triggers and trauma reminders and situations. And I want to emphasize that there are some times when maybe avoidance in this moment makes the most sense for you, right? If the environment is too stimulating, if you can't create circumstances that feel safe or manageable for you. And this might be a good indicator that you may benefit from an evidence-based therapy to work to be able to participate more actively in these festivities the next year.
Excellent.
Could you tell us a little bit about evidence-based therapies for PTSD?
Absolutely. So in terms of evidence-based therapies for PTSD, I can't believe our time. Wow. I can't believe we've been chatting for this long, but this is fantastic. So in terms of evidence-based treatments for PTSD, the things that were most helpful for me was something called cognitive processing therapy. And what that actually did was it allowed me to sort of write out the experience with pen and paper. And then the psychologist that I was working with was able to work with me to identify trends and categories and themes that were showing up. And then we were able to create a proactive plan on how to think differently about those experiences. That was the go-to for me and the turnaround. I also participated in cognitive behavioral therapy for insomnia. So one of the symptoms that has been probably chronic has been a challenge with staying asleep. I'm able to fall asleep, but I sort of wake up a little startled sometimes. So I have to kind of work with that. So the cognitive behavioral therapy for insomnia helped me to get a better understanding of when to stop caffeine. So I don't drink anything caffeinated after 12 p.m. because I've learned over time that that interferes with my sleep cycle. I don't bring electronic devices into my room. I don't have the TV on because of the blue screen. I don't do any computer work 2 hours before going to bed. So there are tons of measurement-based options that are very, very supportive. And we have those things available here at the VA Maryland healthcare system. But those are the few that I can say really helped to turn things around. And lastly, there's another therapy that was called STARE. Because of the PTSD, I really had a hard time relating to other people in sort of relationships or friendships. And that STARE therapy, another evidence-based therapy, helped me to improve my interpersonal skills so that I could relate better to myself and to relate better with others. It has been a journey. Definitely did not go in a straight line. And if you saw a couple of episodes back, I had to re-enter therapy. Can I give an update?
Sure.
Of course.
So I'm happy to report that I just went to every 2 weeks, you guys. I was going weekly, but now I'm just going twice a month. My scores and things are coming back down to baseline where the PTSD is not as evident. So I'm so grateful that we have this ongoing support. It's not a one and done. There's a lifetime of support that is available to us through the Veterans Health Administration and our community partners if there are things that you need with care in the community. But I just wanted to provide an update. I was scared to go to every 2 weeks, but I think I've been on it for about 6 weeks now, and I'm doing just fine. So I'm working my way back to baseline.
That is wonderful. I just want to say that evidence-based therapies are very structured, short-term therapies that have been shown to lead to decreases in symptoms for most people. During these treatments, therapists pay close attention to symptoms to make sure that they're working. And if they're not working, that is a time to problem solve what might be getting in the way and even pivot to a different treatment. So they're very practical, very useful, very active. Many of them involve homework or things you do between sessions to help you take the tools and skills you're learning and put them into your day-to-day life for lasting change. So if you are struggling with symptoms of PTSD and this holiday is difficult for you, you're noticing you're jumpy, you're having more nightmares, things are triggering memories or experiences you've had in the past. You are having trouble sleeping. You're feeling really irritable, feeling distant from other people, maybe reluctant to go out and do things you enjoy. It may be a good idea to think about PTSD treatment. And I am a resource. You can reach out to me directly for care and consultation related to this. So I will give Rosalia my phone number.
You can say it out loud and I can
Okay. My phone number is 410-350-5464. Do not hesitate to reach out with any questions or concerns. As Paula shared, there are a lot of resources available to you to help meet you where you're at and get you connected with the care that would make the most sense for you at this time.
Yes.
I have another question. All this time we've been talking directly to veterans. Well, veterans don't live in a vacuum. They live with family members. Is there any assistance for family members who are living with veterans? Because it's hard to tell sometimes if you are being irritable and you're having these symptoms. What do you want family members to know if there's a veteran who they love who is, doing acting out all these symptoms but not recognizing it in themselves?
So I would say just continuing the thought that Dr. Calmes shared with us. It's very important to meet the veteran where they are. So safety, safety, safety always. If there's any concern about harm to self or harm to others, that's an indication that you'll need to branch out and get additional assistance. So that those are experiences that 911 would have to be called right away. So the first thing I want to say is that you don't have to do it alone. And we want to invite you, as always, to become an active participant in the veteran's experience. That helps to build trust and allows for open dialogue and communication, because sometimes, for me, I felt ashamed to have to tell someone that I was having a mental health challenge. So normalizing these things, having the conversations, meeting the veteran where they are, come on into the VA Maryland healthcare system. And there's NAMI. NAMI is the National Association of Mental, National Alliance of Mental Illness. Thank you, Dr. Calmes. And NAMI has direct family support. Here at the VA Maryland healthcare system, you can certainly inquire about family therapy and family supports, because those things are available. You would have to discuss that with your mental health provider and or your primary care if you don't have a mental health provider, so that you can move forward with that. So there are options, but ask the veteran first. Don't assume anything. Just a simple, how are you doing today? Mm-hmm. How are you feeling today? And just listen to understand and not to reply. Just hold the space for the veteran. Be present and open, receptive, and just listen. And that is healing in and of itself, to be seen and to be heard and to know that your life matters. That's going to make a huge difference.
Absolutely. And there are times when even getting into treatment is a process. Mm-hmm. Someone initially may not think they have a problem, and over time, they may come to see that there is an issue and be more willing to consider treatment. Mm-hmm. So I think Paula's approach goes a long way in creating an open dialogue where the person feels comfortable talking and sharing. that may help them move closer towards considering treatment in the future.
Mm-hmm. And lastly, I'll say that the Veterans Health Administration has a robust website.
Mm-hmm.
The National Center for PTSD is an
Absolutely.
invaluable resource.
Mm-hmm.
There's also a website that is called About Face. You can go on that website, whether it be a veteran and or family member, and you can actually look for a particular symptom, a particular experience, or the evidence-based treatments that we're referring to, and you'll see little snippets of veterans explaining their experience with the treatment. So again, ensuring that the veteran knows that they're not alone. That is so very important. So those are two huge resources. So there's tons of patient education out there for the family members and for the vets, all kinds of videos and things like that. But the About Face is very, very, very helpful, especially if your provider says, I'm considering, an evidence-based treatment. And you get home and you're like, now, what did they say? And these two resources, you'll be able to get some additional information, which will help you to form your questions to go further with your treating provider.
Is there anything that I did not ask that you want veterans and their family members to know about getting through this holiday season with all the, because it's going to be extra this year because of the 250, and when is a good time if they feel like they're not coping to actually visit the ED?
Certainly, if they're having thoughts of harming themselves or anyone else, that may be a good time to visit the ED. Or at the very least, to talk to a treatment provider or a loved one to get more support.
Mm-hmm.
I think that we have emphasized that there is a lot of different type of support available through the VA. And we have talked today about symptoms that are common during the holiday season for many people, not only veterans. I think it's important to realize that this can be a difficult time for many people, and that many of your experiences are normal given your past trauma. Do you have anything else to add?
Yes, just a few closing thoughts. Recovery is a journey. It's not a destination. I would encourage veterans and family members to prepare for the upcoming holiday. Perhaps something that we've discussed today or a resource that we have provided, you might be able to kind of take a look at it ahead of time. And I would invite viewers as well as myself to think about one coping strategy that you can try this week. Maybe something that you haven't tried before that may assist with that. And I just want to thank everybody for joining our continuing conversations. And I wish everyone a safe and meaningful Independence Day.
Thank you, Dr. Calmes and Dr. Smith-Benson. I appreciate your time and energy today. Thank you, everyone who gave us likes. I really appreciate that out there. This video is going to live on our YouTube page. It's going to be available on Facebook for a little bit, but it's going to always be on YouTube. So if you feel like you want to go back and listen and it's no longer on the Facebook, you can go to our YouTube page. Just go to YouTube and search for VA Maryland Healthcare System and it will pop up. So thank you very much. We wish everyone a safe and wonderful holiday. Happy birthday, America, 250 years. All right. Goodbye, everyone.
Bye-bye. Take care, everyone.